And I think one of the key issues, I think, when we're looking to develop and change services is to try and compare like with like. So I think for commissioners in South Devon, integrated services delivery in South Devon, they recognise the value for money that they get. This service is evidence-based. We've been operating for about 8 years, so we've delivered services to about 15,000 sessions to about 1,600 people. We've got a lot of data now which can support and demonstrate the value. We also use a clinical outcome tool, so we can show that 80% of the young people that come into counselling, their well-being improves because we've got the evidence base. We provide value for money. We're supporting community well-being. When individuals come in for counselling, they might have a problem with their relationships, they might have a problem with drinking, they might have a problem with drugs. So it's really a public health issue. We're helping to reduce the level of alcohol dependence, we're helping to reduce domestic violence, we're helping to improve school attendance. So I think it's important to understand that actually this is a community well-being service as well. Obviously we have a close working relationship with CAMS, and I think the voluntary sector service here complements the work of statutory mental health services. Just to illustrate that, at the bottom line you can see the Young Devon Counselling Service straddles across from different levels of input, and we get almost all of our referrals come from universal services, so that they come from schools. 30% come through the schools. GPs, 16%. We know collections refer in. We get referrals from CAMS. So we can not only refer into CAMS, we also get referrals from CAMS. So I think one of the added values of the service is actually it's helping to triage, it's helping to reduce the number of inappropriate referrals through to CAMS. So that CAMS it doesn't get overloaded and overwhelmed by loads of inappropriate referrals. And of course, Young Devon being a youth organisation, we work for young people from 12 through to 25. So we don't have this problem which exists in, say, statutory organisations where you get a problem around transitions. What happens when a young person becomes 18? Where do they go? Are there any services in adult mental health? Well, we actually deliver service to young people from 12 through to 25. In fact, about 20%, and sometimes more, of our referrals are from young people who are 18 up to 25. We also get referrals from community mental health teams, from adult mental health. So I think that just helps to show that we are part of an integrated service. We are supporting and we get support from statutory agencies. I'm just going to have a slug of water because my getting rather dry. Too much coffee this morning. How do we do it? We do it right from the beginning. When we started a pilot in Kingsbridge many years ago, we wanted to have staff who were qualified to meet different levels of need, recognising that if you have an open access policy, you're going to get young people dropping into youth centres, to youth inquiry services who have fairly low level of need, but you're also going to get young people who've got high levels of need. So in the South and West Devon, we have psychotherapists, trained, qualified psychotherapists, two of whom actually are very experienced over many years of working in CAMS and also in adult mental health. They're paid on a sessional basis. We have diploma level counsellors who are qualified and at diploma level. And the key people in this model of service are the counselling coordinators. We have 4 part-time counselling coordinators in South and West Devon who manage referrals, who provide clinical support to the other counsellors, and who also do direct work themselves. So they have small teams of volunteer counsellors. So at this point in time, we can say that at diploma level counselling, we have 11 volunteers who are qualified at diploma. We have 4 part-time counselling coordinators who are also qualified at that level. And then we have opportunities for those who are in training, but in their second year of training for counselling, to also become volunteers. And they also receive supervised practice. Because one of the key issues around when you're working with young people, particularly around mental health, is issues around clinical supervision. So, recognising the importance of this in terms of maintaining safety and ensuring quality, we have a wraparound system of supervision within the service. So, within the service, all the volunteers are supervised, clinically supervised by the counselling coordinators. They are themselves supervised by psychotherapists, who are themselves supervised by child psychotherapists. So we have a wraparound good clinical governance. What issues are coming? What are the issues out there? 1,500 young people coming into the service. What are they troubled with? Well, the vast majority that come in, and this is in order of prevalence, 60% of young people who are coming to the counselling service are very anxious. They're stressed out. There's a lot of anxiety out there. And that's in good times. That's over the last 10 years. Now, that anxiety and stress may be related to their family situation. It may be related to their school situation. It may be related to a variety of factors. But anxiety and stress is a dominant factor. We know also that over 40% are coming in to talk about problems, relationship issues with their parents and sometimes their carers, but predominantly birth families. We know that 30-odd% are coming in to talk about their families who are separating, who are split. Maybe the parents are going through divorce or separation. These are some of the key issues which are facing young people. We know that 30% of young people who are coming into our service are showing signs of depression, and not surprisingly, feeling they've got low self-esteem. These are the key issues facing young people. Further down the order, there's communication difficulties, issues around relationships with peers, bereavement, emotional abuse, quite often linked to the family situation, school and employment attendance. So when the young person is coming in for counselling, these are the key issues which most of them come in with. I mean, clearly these are the most prevalent issues. Then some young people are coming in with actually very serious issues of abuse or neglect, and we support them. And clearly we also link up to all the child protection procedures as well.